Hey, I'm Dr. Manning, founder of Mississippi Vein. This is a practice that I started back in 2008, and I'm just looking to shoot a short video to tell my referring physicians and nurse practitioners kind of what we do here and our approach to treating venous disease. The majority of the things that we treat are varicose vein disease, venous ulcerations, and spider veins. Probably by the most thing we do is varicose veins, and that is for the most part a genetic problem. The varicose veins at the surface aren't the problem. It's the veins beneath that are producing them. We use a combination of endovenous laser ablation, which ablates the underlying vessel that's causing the varicose veins at the surface. And then we use microphobectomy, where we remove the varicose veins, and we're able to do that in such a way that we leave little to absolutely no mark on the skin. And then any associated spider veins that they might have, we treat those with foam sclerotherapy, and it's all done at one time. We'll split the legs apart because depending on the size of the case, you kind of have to do that for time reasons. And I always like to be able to see the leg 2 or 3 times to get the patient the absolute best result that I can. By far and away, our patients are our best source of advertisement. And so, it's critical that we get an excellent result on all of them. We send the before and after pictures to our patients, and we send the before and after pictures to our referring physicians too. So I think that's important. I think if you're doing quality work, you want to send those pictures. All of our patients are sedated for our procedures. I used to be an anesthesiologist back in the old days, and I like everybody knowing that because patients are safe here, and I'm not afraid to sedate them. I want people to have an excellent treatment experience here, not just a good result. People are going to forget what I say, they're going to forget what I do, but they're not going to forget how we make them feel. And so that treatment experience is paramount for me. We see patients back 2 weeks after we're finished with them to make sure everything's perfect and everything looks like it should. And then we see people again at either 2 or 3 months, just because I like for them to live with our repair for a time period so I can look at it, make sure everything is held up. And and that's when they get their before and after pictures, and that's when we touch up anything. If something is not absolutely like the way I want it, I touch it up right then at no cost to the patient, because we want them leaving Mississippi Vein with the absolute best of the best. Those patients that are on anticoagulants, we don't have to stop those. A lot of my referring physicians and nurse practitioners like knowing that, so that's certainly something that we do that other people maybe don't. We keep those anticoagulants running throughout the procedure. Um, People ask me all the time the chance of a blood clot. That's very, very, very rare. We've done well over 30,000 intravenous laser cases now, and I don't know if I've seen 20 or 30 through the years. I would be surprised. No one has ever died at Mississippi Vein. Everybody laughs when I say that, but I think that's important to know. Uh, but if somebody has had a clot before and they're not on anticoagulant, we always prophylax them during the procedure and then for a few days after it. If somebody's a diabetic, or maybe they have, some sort of immune deficiency or on some medicine that affects their immune system, we give them antibiotics in the room, and we give them antibiotics for a few days after that. Infections are incredibly rare. I see 1 or 2 of those every 2 or 3 years, but that is very, very rare. But we're respectful of that. If somebody they've had a joint replaced, we cover them with antibiotics too. So, our goal here is treat venous disease as comprehensively as we can from the inside out. The chance of recurrence based on the way we do our procedures is rare. Yeah, I typically, if I'm going to see recurrence, it's typically in a patient that suffers with morbid obesity. And those are the people that you may have to work on 2 or 3 times throughout their lifetime. But for the most part, it's one and done with respect to varicose veins. Venous ulcerations is something else that we treat here, and we treat the underlying cause of that. Venous ulcerations are something you cannot heal at the surface. You can send them to wound care centers for the rest of their life, and they may get it to heal for a little while, but it'll always come back. You have to fix the venous hypertension at its source. We do that with endovenous laser ablation. And then we use platelet-rich plasma to help speed the healing of the ulceration after what we do. For those people who are in wound care, we send them back to wound care. We're not taking them from them, but they need to get done what we do to put them in a position to heal for the long term. But we still use wound care treatment centers to help them with their wound after what we do.